Hi, we are in a very tough situation right now with the COVID-19 threatening many lives of people. Businesses have closed down, no schools at the moment, and there is a lot of anxiety among people. Now, what does all of this intervention mean? All over the world, they have applied all of these best practices. Much especially like in my home state, Minnesota. So from today at midnight, there is a stay-home order that we are not supposed to move from home unless we are performing essential services. Many countries have put all this in perspective. So we are in an unprecedented period, and I wanted people to know that COVID-19 does not get cured. We only do interventions to stop its spread unless we find a vaccine, which they are still working on to find. First and foremost, I want to thank and appreciate our heroes, the people who have gone far and beyond to serve the population which is sick every day, that when others are distancing from meeting people, they are meeting the patients and the people who are more vulnerable. These are our nurses, great nurses. We appreciate you. Doctors, nurses, healthcare workers, police officers, store workers where we buy food. That despite all this, we have to go and buy food, so you interact with these people and drivers and other very people who provide essential services. Just know that we really appreciate what you do. Now, the basic facts about COVID-19 are the things which you have to know. As I said, it does not get cured. So, and 80% of those who got infected with the virus do not even need hospitalization. So don't fear. 15% require hospitalization. And only 5% require ICU care for respiratory aid. Well, if there is no mitigation, at least 5% of the population which get infected is likely to die. And the aim of any interventions which is being done is to flatten the curve. What do I mean by flattening the curve? I want you to look at that curve there. That is the curve. And in that curve, what we do, you can see healthcare system capacity. So in every region, this differs. What is in China is different from what is in USA, what is in Africa. Now, the healthcare system, your hospital, does it have enough beds for this epidemic patients? Does it have enough respiratory ventilators? That is what we call your healthcare capacity, which every state, every region has to have its own assessment. That in the case of how many people at a time we need to accommodate, would the hospital accommodate any people? So that line you are seeing crossing there means that is where the capacity, the number of cases the healthcare system can sustain for a particular time. So in that, flattening the curve, so when you see it up there, it means if the epidemic comes quickly and there are so many number of cases which need to be hospitalized, it will go beyond the capacity of the hospital. And then that's where people will die. But so if we move to flatten the curve, as you're seeing the curve flattening forward, it means that when the number of people are going into hospital, they are going at a different time. That will help the hospital to take care of that. Maybe, so with this intervention effect, if there is no intervention, when the outbreak comes, time to peak epidemic is 9 weeks. Time to reach ICU capacity will take like 6 weeks. But if there is a mitigation like what we are saying, physical distancing, stay home, do all of these other things. If you make people not to be close together, like if they stay home for 2 weeks, it will reduce a rate of infection by 80% if they stay away for 2 weeks. So time to peak epidemic will now move to 14 weeks, which will give, because the curve was flattened, then time to ICU capacity will be 11 weeks, which will be okay. Why do I say like that? Maybe if you look at that graph, so the objective is to lower and delay the epidemic. The line shows healthcare capacity, as we say, ICU, emergency visits, they are on that. If you don't do intervention, a number of people will be transmitted quickly. Like if people stay together, that is what will happen. But if you control and you delay, you control slow the spread of the disease and reduce the burden in hospital, it will flatten with controls. And these controls will include hand washing, teleworking, limiting large gatherings, minimizing travel, and stay home, things like that. So that will bring us down to that. So really the goal of any country, I've seen even in some countries like Kenya, where people are trying to say that the police have to force you to leave, do not have gatherings, like the police have to disperse people from going to church. This is something which needs to come out of ourselves. So let us delay the outbreak, decompress big burden onto hospitals, and diminish overall case on the healthcare input. Take for example, I'm giving the Darajambiri market in Kisii, because that's where I had people that the police were chasing people. In a normal market, that's how it is. You can see how congested it is. So what will happen if people are mixing like that, others have the disease? How many will it spread? If it spreads, will the hospital, the local hospital, be able to accommodate all the large number of people? That's why we need to follow the orders. And this came, let me talk about the Spanish flu. The Spanish flu, which occurred in 100 years ago. It's 100 years because it was 1918, 1919. The pandemic wiped out up to 100 million lives. Up to now, scientists are struggling to explain what caused it. Now, the Spanish flu in 1919 went all over the world. And that is the number of people. In US, it is 675, Canada, 50,000, Africa, 100,000 people died. In South America, 300 people died. So, total 100 million died. Now, why am I giving you this example? This is something not unprecedented. So, I'm giving a case of 2 towns in the US during that time, what they did, and you can see why intervention is very important. In 1918, the city of Philadelphia threw a parade that killed thousands of people. They ignored warnings of the epidemic among the soldiers preparing for World War I. March, they were doing the march to support the war effort, which drew 200,000 people who came to watch the procession. 3 days later, every bed in Philadelphia's 31 hospital was filled with sick and dying patients. They were infected by the Spanish flu. So many people died. That was the parade. There were so many, and that's the parade in 1918. So, in St. Louis, this place is a different story. A city which is just 900 miles away. Within 2 days of detecting these first cases among civilians, the city closed down schools, playgrounds, libraries, courtrooms, and even churches. Work shifts were staggered, and the street car ridership was strictly limited. Public gathering of more than 20 people were banned. They were extreme measures. And this is the practice what we call social distancing. Now, this mitigates the spread of the flu. And actually, the number of people in St. Louis who died were less than half of those in Philadelphia. Two cities, different interventions, different results. So when you are being told, actually that is the graph which shows Philadelphia, the number of people who were infected. When they realized, you can see Philadelphia went up very fast because of that parade. So many people were infected in that parade. But you see what St. Louis did? Because of social distancing, it could not, the capacity remained low. The death rate remained low. So, with that, when your government is telling you to stay home, proudly stay home, because that's how we have to fight this. And on top of that, we have to do our prevention, washing hands with water and the soap, sanitizer, at least 20 seconds. Avoid contact with the sick people. Don't touch your eyes, nose, or mouth with in unwashed hands. Don't eat raw food, thoroughly cooked meat and eggs. Avoid contact with animals and animal products. And if you are infected, stay at home. Avoid contact with other people. Call emergency. Cover your nose and mouth when you are covering. We can't stress that. Let us follow that. And I know with what is happening, we are going to win this war. Keep safe.